we are recommending sleep and decreasing stress. But as a patient, how are they managing and how do you guide them?
It's actually very unfortunate in the sense that, in my OPD also, I spend 15, 20 minutes, sometimes 30 minutes explaining them how does it happen. And in the end, then, they say, doctor, aap koi dawai de dijiye. And then you feel, oh my God, I spent 30 minutes explaining them what it is. So I guess, probably they are trying at their own end, I mean, you also would agree that weight is a very big problem, it's like, it's not easy, for many people. It's very easy for me to say, okay, reduce stress. But what is it which is going on in your life which is making the stress to happen? It could be financial, it could be your career, it could be relationship or whatever. There could be multiple reasons. So it's very easy for us as a physician also to say, okay, reduce stress, do this, do this, do this. But in the end, people want a solution. You know, what is to be done in case I'm not conceiving now? What is to be done? Let's right now talk about infertility. PCOS has got many other problems, acne, hair fall, all those things. But infertility, people are really desperate. So it has to be a multidisciplinary approach where on one side we are telling them, okay, you need to be taking care of your lifestyle. And of course, as doctors, we are there to help them. There are various medical protocols these days, ovulation inductions and IUIs and IVF and now egg freezing. A lot of things are coming up. So I think in today's world, both the things need to go side by side. And fertility is not the final goal. Ultimately, you need to be healthy to look after the child who's going to come. So even if you've conceived by hook or crook, but you need to be healthy enough to be looking after the child. So I think both the things have to go hand in hand. And the same thing applies for every other problem of PCOS like acne, hair fall. Today you've rectified acne by all kind of fancy dermatology treatment. But in case you have not really worked at the root cause of it, the thing is going to come back again. So,
Acne is because of elevated androgens.
yes.
Mm.
So, most of the PCOS patients actually suffer from hyperandrogenism. So, which is they get acne, which is, this is a cystic, bad, painful acne, which typically happens on the jawline. They are typically more hairy and that too at wrong places. Like men, they have hair
Hair.
on the face.
Correct.
And so basically these women, they tend to get hair at at the places where men have hair. So men typically have less hair on the scalp and more hair on the body. So these women complain of scalp hair loss, more hair on the body, more acne,
Mustache and
mustache,
hirsutism.
hirsutism. So they have, hair on the upper lip, on the chin, even, medically there's a grading system for the hirsutism. We have something known as Ferryman-Galloway score, where you can actually give a score that how bad the hirsutism is. It depends upon what is the level of the androgens. Now, hyperandrogenism, other than PCOS, could be because of various other actually pathological
Yes.
reasons
Yes.
also, like adrenal causes and other things. But in today's times, the most common reason for all this is PCOS. So the first thing which we have to investigate, in fact, most of our patients are actually referred to us by the, dermatologist. Somebody's having acne, somebody's having,
Hair
hair
fall.
fall.
Ah.
So once they haven't found a cause, they come to us. And most of the times we invariably find an underlying PCOS. And also I would want to say that PCOS is not just the PCOS. In fact, many times on the ultrasounds, the ovaries are actually normal size ovary. So it's actually the insulin resistance. PCOS is actually one manifestation of insulin resistance. PCOS is actually just the tip of iceberg for which the patients come to a doctor. But actually, there is so much which is happening in their bodies which probably will manifest little later, like obesity, truncal obesity. There's a whole metabolic syndrome, which we all know, diabetes, high
Right.
blood pressure,
Correct.
everything.
Correct. Do you see increase in belly fat as well?
Absolutely. As Indians, we all have, We all are pre-diabetic, and we all know this. So we need to be even more careful. If you see, people who are thin also have some bit of belly fat, right? So there's a term called, I think, tofi. It's like thin
Yes.
outside, fat
Fat on the
inside.
inside,
So it's,
correct.
even if people who are thin, I mean, even I have to make sure, this fat doesn't
Right.
come in. So it's like we are genetically programmed to have that mesenteric fat inside. So we all have to be very careful. And of course, I mean, you've done so much of work on the insulin resistance, that what is it which causes insulin resistance in the first place? As doctors, I've seen people go to an endocrinologist, they say, oh, you have insulin resistance, you take metformin. But why the hell is insulin resistance happening? Nobody's talking about that. It's very easy to just put them on a contraceptive pill, or maybe just put them on a metformin or whatever. But will this solve the problem? No. I've seen so many times, Dr. Paul, this is so very unnerving. A 14-year-old girl is being put on an oral contraceptive pill. That's bad. That's bad medicine. I mean,
What is the age group that you see PCOS usually in your practice?
so theoretically also, PCOS can start even before the onset of menarche, and it can go on till the menopause goes in. So, because we need to understand, it's not just the PCOS. The problem is insulin resistance.
So delaying menarche as well as a sign of insulin resistance.
Yes, yes. In case a girl is amenorrheic, let's say 16 or 18 years, probably, she could be suffering from some kind of a hormonal imbalance, because of which the first period, which was supposed to be coming, has not come until now.
Early puberty is a sign of insulin resistance?
So we can have various
Both
things. We
sides.
can have early puberty also. We can have late puberty also. I mean, just 2 days back, I mean, it was so funny. There's a mother who comes to me with a daughter who's 120 kgs, and she's saying, "Oh, my daughter is thoda sa healthy." And my response was, "Nahi, thoda healthy, nahi, totally unhealthy." I don't know whether I should have said that or not. But then, as doctors also, we feel desperate. How do we make people understand that they need to take control of their lives to make sure? I mean, everything is not a doctor's responsibility. You need to be doing your own bit to make sure that things happen properly.
Uh-huh.
So-
So early, one of the doctors that I talked to, they said that previously they used to see early puberty around like 11, 12. Now they are seeing around
Yeah, very
8,
common.
9.
8 years. I mean, this is like very, very disturbing, because at 8 years, the girl is not mentally or emotionally mature to understand the implications of having a period. So, and also there's a medical problem, when the periods they start, they basically signal the closure of epiphysis. So the growth, or the
growth.
height also could remain stunted. So, I always ask my patients, especially their mothers, आपकी daughter पढ़ने से ज़्यादा खेलती है कि नहीं खेलती है? So as mothers, it's very important for us to make sure that our daughters actually play. Are they going out 1 hour or 2 hours to play? That will let the happy hormones flow. That will make sure that, their muscles, joints, insulin, every damn thing is working properly. So
When childhood obesity is related to early puberty?
absolutely, 100%, 100%. Early childhood obesity is related to PCOS, and of course, early menarche. Yes, absolutely.
It's very directly proportional.
100%.
100%. And you are seeing a lot of childhood obesity in your practice?
A lot. Of course, pediatric patients don't come to
you.
me.
But after menarche, they might.
Yes. Like it's like common in metro cities to see young girls, 14 years old, 15 years old, 100 kg weight, 120. It's like, it's alarming.
It's alarming. So I have been, after talking to so many doctors in the practice, it's very clear that I think everything starts with the diet.
Everything starts with diet and movement.
And movement.
And happy state of being.
In that initial first 10 years, I think one thing has happened more recently in the last 15, 20 years is high fat diet.
Yep.
High fat diet, right? So in your practice, when you're seeing patients, do you see that they are having increased amount of fats in the early part of the?
Yeah, absolutely, absolutely. You know, I was comparing this with our childhood. We used to get a treat once in 3 months, and that was the samosa at the end of the exams. And today, when I talk to people that how many meals in a month you have, they say practically every second day they go out and eat. I mean, this is not done. And we know, the kind of stuff which is put outside when you go out, eat. Obviously, the processed and packaged food, they're all bad. So people don't have time. And I understand because of their busy schedules, because of, they're working late, they're in hostels. So the problems are also too many, but we need to find out the solutions. Like I said, like I was coming from the airport to Mumbai. Now, in such rains and such a busy city, where would you find a park to go out and exercise? Not many people would be able to afford a gym, right? How does a common person manage this? As together we all need to find out solutions to this. It's not just PCOS, it's a bigger problem. It is affecting you as a doctor, it is affecting a physician or an endocrinologist. All of us are in the same boat where we need to treat these patients. So on a bigger scale, we need to do something to make sure that people actually end up following a healthy lifestyle. कौन सी city में there is a pathway to walk? I don't think so in India we have any, space for people to walk or let alone exercise.
I'm involved in a research with the gut bacteria and PCOS over there, and we have figured out that high fat diet is interfering with the gut barrier, and it increases this bacteria called Bacteroides. Bacteroides is a gram-negative rod and gram-negative anaerobic thing, and then that gram-negative, once it goes inside the blood, your inflammation gets started, right? That is one way of insulin. The second way that high fat diet does is it inhibits the bile acids.
Okay.
And bile acids are necessary to regulate the cholesterol. And bile acids stimulate some IL-22, an inflammatory marker, and that increases the folliculogenesis.
Very much possible.
Right.
Very much possible.
So nowadays the research is thinking along the lines that can we give IL-22 to improve the ovarian folliculogenesis? I am saying that instead of giving IL-22, how about decreasing the fat?
We always love to find out complicated solutions to simple problems. It's a fact.
It's a fact. So the other thing that I think is the high fat diet is not your regular oil. That's not the case. I think it is all the processed foods, ultra processed food that is coming in.
Yeah.
And simple thing we can, if it was my family member who's having a PCOS, I think we should just draw a line and then says that no packaged foods at all. And then you have seen people resolving their symptoms.
Absolutely. So, Dr. Paul, I'm myself a yoga person. I'm a certified teacher. So I learned it because yoga helped me a lot, and it's a beautiful form of taking care of your body and mind both. When you do those breathing exercises and when you sit in just quietness, not just, let's not call it even meditation. People find it very difficult. Even that helps you to settle down. So about 2 years back, we actually did a program of managing PCOS with the yoga program, 3 months, and we got some amazing results. Amazing results. People lost weight, people's inflammatory markers came down. So it was such an eye opener that all this happens at the level of the brain, and of course coupled with the fact that high fat diet and other problems. So like I said, we need to have a multidisciplinary approach where a nutritionist is working, where a GI person is working, maybe a fitness trainer is working, endocrinologist, fertility specialist. And these women are actually struggling. I mean, it's not easy for them. I have seen there are people who are literally struggling. So it's, it's difficult for them also. But today, like I said, not many solutions are easy. Like, I gave you one example of an exercise. How the hell a normal person who can't afford to go to a gym, how does she exercise? She's staying in a hostel. How does she train her hostel chef to make a good diet? She's studying the whole night. She has an exam tomorrow morning or a presentation to make tomorrow morning. How does she manage her life? So it's not easy. Modern life is like, it is not that simple as life was simple for us. But people at least should be made to aware that the solution to PCOS is not a metformin or a contraceptive tablet. If you want to reverse your PCOS, then you need to take control of the entire thing in your hands. So this people need to understand. And of course, as doctors, you and I are there to help them.
Correct, correct. In multiple studies, I also read that weight loss is the treatment, correct?
Absolutely.
Weight loss is
Weight
treatment.
loss, even 5% of weight loss can bring about changes in all the markers of PCOS.
5% is, let's say, you're 100 kilos. 95 kilos itself.
5% weight loss also can bring about significant change. So every kg will count. So don't get disheartened, oh, it is just 2 kgs or 3 kgs or 5 kgs. Each kg loss is bringing you, back to recovery.